All right, welcome back. We're gonna finish the chapter with this little lecture video right here. We're gonna start out with some policy applications, what we've been talking about. So the first one is a section that's trying to estimate the statistical value of a human life. So how much is a life worth? The line that connects the combination of wages and risks that we talked about in the previous slide from the last video. So I'll go back here. This line right here is the hedonic wage function. So it kind of brings together the more, or I guess less risk averse workers down to the more risk averse workers and the types of firms that they work at. By drawing a line between them, we can kind of estimate what the trade-off is. Well, some economists try to use the existence of that hedonic wage function, kind of estimating that line to try to estimate how much people value a human life, how much more money they're willing to spend to make them safer. So, yeah, if you're following along your textbook, you could look at table 5.1, and that shows the risk of a workplace injury across a lot of industries. And you see that there's wide variation between them. Some are exceedingly safe, while others are relatively quite deadly, and probably much more deadly than you or I would be willing to do for a career, especially for something over the long term. So models that explore the relationship between the wage and the probability of injury on the job find that a 0.001 increase in the probability of a fatal workplace injury increases wages by $8,700 a year. So let's look about how we can use that to understand how much people value safety. We can compare two firms to do this, and we'll make the math as simple as possible for us. So let's say one has the chance of death at P, while the other has the chance of death at P plus 0.001. Yeah, it makes the math easy. So they pay at the second company $8,700 more per year to each worker to account for that risk. If both firms hire 1,000 workers, this corresponds to one additional worker dying in the second firm, because the probability of a fatal injury is 0.001. Workers are willing to accept this risk because each one receives extra money to work for the riskier company, $8,700 each year. And let's face it, everyone assumes that if there's going to be a fatal injury or something bad that happens at work, it's not going to be them, it's going to be someone else. But now taking more money for a riskier job implies the opposite as well, that each worker at that first firm, the relatively more safe firm, will be willing to give up $8,700 to reduce the chance of death by 0.001. And because there are 1,000 workers at both firms, those 1,000 workers at the first firm are willing to give up a total of $8.7 million to save one human life. So we can use that as the estimate of value of human life and say that workers are willing to pay $8.7 million to save one life. Now, my dad worked for an insurance company. What he did was inspect businesses to ensure that they met reasonable safety standards to prevent injuries so that his company could minimize the workers' comp that they would have to pay out if there was an injury. So I've heard about OSHA for years. OSHA is the Occupational Safety and Health Administration. They were created back in 1970 to ensure the safety of workers, especially in industries like manufacturing and resource extraction, ones that can be quite deadly, but their standards apply to all industries. And their working standards range from basic protections like requiring hard hats in constructions to more stringent requirements like advanced safety protocols in manufacturing. For firms, complying with OSHA safety standards often requires an investment in safety equipment, training, and other measures, all of which affect their cost, adding a bunch of cost to their actual production process, and by extension, affecting their profits. On the flip side, workers typically prefer jobs that offer higher safety standards because these reduce the risk of injury or illness or even death. But if we discussed, workers also care about wages. So how do firms balance the cost of meeting safety regulations while also keeping their wages competitive? And how do workers' preferences for safer jobs interact with their wage demands? We can use the model of isoprofit curves and individuals' utility functions to see how firms respond to safety regulations like those set by OSHA, how this impacts their profits, and look at the worker choice side. So here, this graph illustrates the impact of these workers, the safety regulations from OSHA for workers. Prior to the implementation of an OSHA regulation, the equilibrium point was at point P, right here. So the equilibrium wage is wage star, and the probability of injury is here at rho star. That's the Greek letter rho that kind of looks like a P. So what happens if OSHA sets a safety standard that is safer than the previous acceptable level? Let's say they set it at this point rho bar, where you cannot go beyond this to the right to any higher probability of injury on the job. This will end up shifting the firm out to a higher isoprofit curve. So initially we're on this isoprofit curve at pi star. But to get to this point here, they end up being at this higher one at pi bar. That represents a lower profit level. Remember, the farther we get out, the higher we get up, the lower the profit is for the firm. So it's going to add cost to the firm to try to meet that standard. It's going to reduce their profit level. The hedonic wage function right here, this line, represents the trade-off between wages and safety that each worker faces and what they're willing to do. So we can move down this curve until we reach point Q here, which is right at the new safety standard. What do we see as the result? Basically, the risk of injury is lower. It used to be up here, now it's down here. But the wage is also lower. The equilibrium wage used to be up here. Now, because of that trade-off between the willingness to accept safety or risk and wages, is now pushing the wage down here to this lower level. Firms no longer need to compensate workers for the risk up here because the risk is down here. So again, it's that lower wage. In effect, it's now illegal to accept the job represented in point P, that initial job that we were looking at. The firm is also less profitable because of the cost of reaching those safety standards. In an industry with a tight profit margin, or if the safety standards are particularly costly to meet, this can push a firm to a point where they're forced to cease operations. In other cases, it may be relatively cheap for the firm to get down to that point, and the reduction in wages will be small and it'll have a small overall effect on the firm. What it depends on the type of industry that the firm is operating in and the type of safety standard they're actually implementing, how expensive that would be. Now, that previous example assumes that workers accurately perceive the risks that they face on the job site. But anyone in 1950, if you would ask them about mesothelioma, you would just get blank stares. There were a lot of things like asbestos that we did not know were bad for us. And I'm sure there are chemicals today that workers work with in their daily job that we don't know are bad for them yet. Additionally, workers can misperceive risks. The simplest example is looking at a risky job and thinking, I know what I'm doing. Unlike those other guys who don't pay enough attention or show up on no sleep and try to operate heavy machinery, I'm not going to hurt myself like they do. I know what I'm doing. So where a regulator like OSHA really shines is finding places where workers misperceive the risk. They think they're safer than they really are, and regulate those areas to bring the market in line to what we would expect if workers had full knowledge of risk. A lot of times when we see regulations, and we'll talk about probably a few more in this course, where if workers had full knowledge, of course, we wouldn't need the regulation. But because they misperceive, they don't exactly understand what's going on, or they don't realize that the risk or whatever negative thing is higher is more likely, by stepping in, regulators can act as if they're revealing information and push us towards what we'd have if people had full knowledge. So let's look at the hedonic wage function in this graph. The worker is receiving wage W star, this equilibrium wage. Now, they think their risk level is at rho 0. They think they're on this utility curve, and the probability of injury is low. But in fact, in this case, they're wrong. The risk of injury is much higher at rho star here. So that's as if they're all the way out here on the utility curve U star. Because they think they're here, this seems to be a great wage for them, more than they require to work for this job. But because they're wrong about risk and the risk is actually higher, the government can end up helping them by imposing some safety standard. Let's say that they set the maximum acceptable risk at rho bar right here. It is higher, so it's Yeah, higher than they thought that they had, but much lower than the risk they actually faced. Their wage would end up declining. You look at where this utility function crosses the hedonic wage function at this safety level right here. That's going to be that corresponds to a lower wage than wage star that they were receiving before. But their probability of injury is much lower, much closer to what they thought they were at and what they were willing to work for.